Of our good old standby. And he's Morton Walker, a medical writer, talking on olive leaf. Extract. Yes. Morton?
Yeah, thanks. Does it fit in here?
Yeah, sure.
Hello, ladies and gentlemen. It's a pleasure to be with you once again. Would you believe this is my 24th year of lecturing before the Cancer Control Society? This is one of the more, thanks. This is one of the more worthy organizations that certainly commands the tree very badly right now, because, as it happens, there are nosocomial infections. That is, we are in a world of superbugs that are resistant to antibiotics, and we have a coming plague of new viruses, bacteria, fungi, protozoa, and other parasites that are affecting us because we have no virucides or fungicides or bactericides that work against these conditions. That is until now. But as it happens, some 2 million Americans get what I just mentioned, nosocomial infections, that is, hospital-acquired infections. They go into the hospital with one kind of condition and come out with another, an infection of some type that they acquire from the hospital. And in fact, 22,500 Americans die from these hospital-acquired infections each year. So the golden age of antibiotics has ended, but we now have a substitute, olive leaf extract, which works exceedingly well to overcome every one of these microbial infections. The amoeba of protozoa, for instance, or Candida albicans of the yeast syndrome, a fungus, or any form of bacterial invasion, or every kind of virus. I'm talking to you today about, for instance, an antimicrobial agent that comes from a plant, the olive tree, made from the leaves of that plant, that cures, literally reverses every type of herpes infection. Do you know that 35 million Americans have genital herpes, and that some 70 million Americans have shingles from one time to another time? And these conditions are eliminated because olive leaf extract treats bacteria and spirochetes, a type of bacteria, and viruses and rickettsia. These are bacteria-like parasites, and chlamydia, virus-like bacteria, and fungi, and yeast and mold, two specific fungal infections, and protozoa, which are single-cell animal infections, parasites, and helminths, which are worms, and algae, which are primitive plants. Olive leaf extract eliminates every one of these pathological microorganisms from your body. So I'm speaking to you today about a highly important subject. The first time it was recorded medically in the literature, the medical literature, was in 1827, and then again it was rediscovered in 1855, but not much was noted about it, except that a bitter tea was a source of getting rid of malaria, because this olive leaf extract gets rid of malaria. And the extract made from olive leaves brewed into a tea helps to overcome malaria. Later in the 19th century, oleuropein was discovered. The active ingredient in olive leaf extract is called oleuropein. Take note of that. Oleuropein is a substance which helps protect the olive tree against the various pests that attack that tree. Especially if the tree is in a stressed condition where it's not taken care of, then the oleuropein component in the olive leaf is very high, and the tree protects itself against the various flies and worms and bacteria that invade it. And so now we've discovered that the same oleuropein in the leaf that protects the tree can be converted and used to protect people. And as it happens, the Upjohn Company, a pharmaceutical company, discovered this in 1969. It investigated the oleuropein to try to distill from it the therapeutic component, and they did. they eliminated from the olive leaf and made into an extract calcium ellenate. Elanoic acid is the active component of oleuropein, and when a salt of elanoic acid is converted into calcium ellenate, that is the active component. And so they tried to turn this calcium ellenate into a patented drug. Of course, Upjohn, being a pharmaceutical company, were going to make money only from patenting the drug and selling it on the market for a big price. As it happens also, they were trying hard to create virucides because there were no virucides to attack the various viruses that were attacking us back in 1969. And they worked hard at turning this into, this calcium ellenate into a drug, and they failed. They did do massive numbers of tests and found that calcium ellenate of elanoic acid, of oleuropein, of olive leaf extract is totally safe, causes absolutely no adverse side effects, and it does work exceedingly well in certain aspects. But they failed to make it a drug that worked immediately because they were dealing with you might say, a fluke of nature. This fluke of nature is that the molecular structure of oleuropein was causing the isomer light. Every molecule has the ability to turn light right or left, dextro or levo. And all Upjohn could do was turn out an oleuropein which turned light levo, left. And so they were creating L-oleuropein, which worked in maybe 3 or 4 days, but the American public wanted something that would work perhaps in 3 or 4 hours. Upjohn was unable to accomplish this. And this remained the case until 1995, when a company discovered the process to turn the isomer light, rather than left, to right in the oleuropein. And when it did that, then the oleuropein worked against the microbial infections in a few hours. Consequently, if you're taking olive leaf extract on a regular basis, as do I, you'll never get a cold. You'll never get the flu. When I say never, I'm in no way restricting the word. I'm telling you it's a fact. You take this and you don't get infections. And if you have an infection, rather than take the preventive dose, which for me is 2 capsules a day, 1 in the morning and 1 in the late afternoon, if you were to take the therapeutic dose, which is 6 capsules a day, you'll get rid of the infection from your body right away, within a few hours to a few days. And as it happens, the oleuropein, which is made with the isomer light turning to the right, the dextro light, the patented process has caused this oleuropein to also come out combined with a variety of synergistic substances which not only eliminates infections of all types, but also is useful in the treatment of cardiovascular disease, specifically high blood pressure and cardiomyopathies. It also works to lower LDL cholesterol. It eliminates peptic ulcers. It helps to overcome hiatal hernia. It takes away the yeast syndrome. It cures you of chronic fatigue syndrome. It cures atrial fibrillation. It takes away your arthritis, which may come from a protozoa. And in fact, it overcomes a variety of health problems. And I'm going to show you today, as part of my presentation, how it cures psoriasis permanently. I'm going to show you before and after slides of some 9 people who were treated with nothing but olive leaf extract for their psoriasis. Some of these persons having the condition severely for 32 years, as long as that. And now they have it no more. They were cured of their psoriasis in 3 months on average. And so I'm suggesting to you that I have a very important presentation for you. Some of this information I acquired by visiting Budapest, Hungary in May, where I was introduced to Dr. Robert Lyons, Dr. Lyons is an OMD and an ND, and he has a clinic in Budapest, and he has a home in California, and he treats retroviruses, and he treats just about every kind of infection with olive leaf extract. And the slides I'm going to show you today is how he treated psoriasis, treating a microorganism, finding by the application of olive leaf extract for people with psoriasis, it turns out these people with psoriasis had their psoriasis come as a result of some microbial infection, probably a fungus. And so this is a new piece of information I'm giving to the world today, you being the world, that psoriasis comes from a microbial infection and can be treated correctly and effectively with an antimicrobial agent, specifically the calcium elenate with the light turned to the right, as is produced by East Park Research Incorporated, which is the company that owns the patent, and it is a proprietary patent. No one can learn what it is, the method that they use in order to turn the isomer light of the molecule of oleuropein to the right, rather than its natural program of turning only to the left. And so I have written a book on the subject. It's called, of course, Nature's Antibiotic Olive Leaf Extract. It's right here. This book is available at the Cancer Book House right over there in the corner of the room, and I'll be happy to autograph books that you may buy there. I'm also going to leave the platform here directly after my presentation and go to exhibit booth number 5, where olive leaf extract is being exhibited, and an olive leaf extract gel is being provided, and I'm going to tell you about these, and a product shown as Fluban is also available. There's a special involved here, a deal, and I'm going to tell you about that near the end of my presentation. So I list in Appendix 20 of my book, Olive Leaf Extract, about, well, every distributor in the world that has olive leaf extract available. They're all listed there by name, address, telephone number, who to contact, so you can acquire your olive leaf extract. It happens that East Park Research is at the top of the list because they have this very fine product that turns the isomer light, making it a dextro light, most effectively treating microorganisms of all types. As I said, East Park Research Incorporated, as it is, was the sponsor of a trip of mine that I took in May to Budapest, Hungary, where I met Dr. Robert Lyon. And this is what I discovered, that olive leaf extract is useful not only for treating these varieties of conditions that I've cited to you, a very small fraction of the number of health problems that it treats. They're all listed in my book, Olive Leaf Extract. But also, I was introduced to the chief gynecologist for the whole country of Hungary. He is the chief of gynecology of the National Hospital of Hungary. And he is treating ovarian cancer, cervical cancer, breast cancer, uterine cancer, hormonal cancers in women with olive leaf extract. And he's not eliminating the cancer, that is, he's not treating the cancer, he's treating a fungus infection which causes these hormonal cancers. It's called, that is, the fungus is called Candida gulamundi. It's a specific species in the family of Candida. You know Candida or candidiasis caused by Candida albicans. There is also a Candida species, gulamundi, which is the source of hormonal cancers in women. Isn't that an amazing point? You are, representing the world, the first to hear about this fungus which causes cancers in women of the cervix, the uterus, the ovaries, and the breast. I am, after all, a medical journalist, and so I bring to you what I am privileged to report on after I've investigated and bring back that information to you. And as I mentioned at the very beginning of my presentation, I consider the Cancer Control Society such a worthy organization that I do reserve some of my more dramatic investigations to bring to the audience here today. Psoriasis is a common chronic recurrent disease characterized by dry, well-circumscribed, silvery, scaly papules and plaques of various sizes. Anybody who has psoriasis knows very well they've got an irritating condition that just doesn't go away, for which there is no cure. It comes on gradually, oftentimes at an early age, and the earlier that it hits an individual, the more difficult it is to get rid of this condition. It attacks the arms, the elbows, the buttocks, the back, the knees, the thighs, the nails, the eyebrows, under the arms, the umbilicus, around the belly button, and he hides the lesions from his neighbors. I'm a former podiatrist, a foot doctor, and I used to treat psoriasis under the toenails. It also attacks the fingernails. And you know, there was never any effective treatment for it. Never. And now there is. So I'm going to be showing you some before and after photographs, slides, of 9 people who are definitely cured of their health problem. And then after the slides, I will be opening myself to questions. And following that, I'll be rushing out to the exhibit space number 5 in order to autograph books. What about this? My book signing will be out in the hallway. George just brought up another book of mine that I've written called Prescription for Long Life. I wrote it with Mitchell Kirk, M.D. I've written, in fact, 72 books, and this is number 70, Olive Leaf Extract. Prescription for Long Life I actually wrote after Olive Leaf Extract. This was number 71. And number 72 was a book of mine called Hyperbaric Oxygen Therapy. I'm now working on book number 73, which will be on dentistry. It's on holistic biological dentistry, and I'm going to be blasting the American Dental Association. Do you know that the American Dental Association, I'm going to give you a piece of information. I'm going to give you a piece of information that will really shock you in my investigations. My research turns up that every time you have an amalgam filling put in your mouth, the American Dental Association makes $1.48. That's because they own the patent on amalgams, and that's why they won't allow the dentist to report to his patient that amalgam fillings are not useful. In fact, they are definitely harmful. Out at the exhibit space, Les Nachman is there, and he's going to provide you with what he calls a show special. You should know that this olive leaf extract costs $30 a bottle. So he's dispensing 2 bottles for $50, and with it, he's giving away my book, no charge, olive leaf extract, and he's also giving away a gel which contains olive leaf extract that you can apply for any kind of skin problem, such as eczema, cold sores, herpes sores, shingles, rashes, acne, insect bites, keratoses, and Dr. Lyon uses it for the treatment of melanoma and other such cancerous topical problems. I don't necessarily say that olive leaf extract works against cancer, but it's what Dr. Lyon does use for that. And also, the flu ban here is available. That costs $15. Now, he's giving away, that is Les Nachman of booth number 5, is giving the gel away, no charge, and is giving away my book, no charge, if you bought 2 bottles of olive leaf extract, which instead of $30, he's selling 2 bottles at $50. That's my commercial pitch. I'm now going to show you the slides, if the projectionist would put my slides on. Thank you, Chuck. Oh, I should do it? Okay. I'm pushing forward. Here's the device. I just pushed forward. Nothing happened? Oh, you have to put it on first. Okay. Okay. Would you shut that light so we could see the slides more effectively, please? Oh, thank you. We're looking here at psoriasis on the trunk of a 28-year-old man who suffered with the condition for 13 years, ever since age 18. We're looking at his chest, a picture taken August 8th, 1997. Did it change? There it is. Okay, here's the picture afterward, the same person. The picture is taken December 10th, 1997. This is 4 months later. That's September, October, November, December. And he has no more psoriasis. He's treated only with olive leaf extract because his psoriasis comes from a fungus infection, not... What? Yes, olive leaf extract. That's an appropriate question, and I will take some minutes to answer your questions directly after my slides. Now we're looking at the psoriasis on the right arm of a 24-year-old woman who suffered with the condition for 10 years, ever since age 14. This picture is taken March 3rd, 1998. She was treated with olive leaf extract. She took 6 capsules a day, 2 in the morning, 2 in the afternoon, 2 in the evening. And this is the same woman introduced to the East Park olive leaf extract. And now she has a set of lesions that are much reduced, only redness, no more scaling. Pictures taken only 20 days after she started treatment. Here's the same woman who's continuing to take four capsules a day now. And this is now 27 days later, or a total of 49 days. She's taken the olive leaf extract, and this is April 18th, 1998. She started off March 3rd, and now it's April 18th. Here we have psoriasis lesions on the dorsum of both legs of a 50-year-old man who was put on the East Park olive leaf extract after he had this condition for 32 years. Picture was taken August 28th, 1997. Now we're looking at him November 28th, 1997, and that is only 3 months later. The same man, after taking 4 capsules a day and continuing, his condition is now gone, and he's at a maintenance dose of 2 capsules a day, which is a preventive dose that everybody should be taking all the time to eliminate infections from your life. The next slide shows... No, those are legs. Oh, all right. The lesions don't show so well. But here we have psoriasis on the arms and trunk of a 46-year-old man put on the olive leaf extract after he suffered with the condition for 25 years. Pictures taken May 6, 98. Oh, sorry. I put in the picture the after first. Here's the before. Maybe it's more effective this way. So he has this condition for 25 years. And here he is after he's taken olive leaf extract, 6 capsules a day for 3 months. This picture's taken August the 5th, 98. And for 2 months, he went on to only 4 capsules a day. And then for 1 month, he dropped down to the maintenance dose. He doesn't have the psoriasis anymore. Here we have psoriasis on the hand, oh, that's the original condition. Okay, here's psoriasis on the hands of a 42-year-old woman who was put on a prescription of olive leaf extract, and she suffered with this hand problem for 6 years. Picture was taken February 18th, 1997. Here we have the same woman 3 months later after she took 4 capsules a day for 2 months and then dropped to 2 capsules a day for 1 month. The picture's taken May 22nd, 1997. I'm just going through these quickly because they're relatively repetitious. Here's psoriasis on the thighs of a 34-year-old man who had the condition for 8 years. Picture's taken June 16th, 98. Here's the same man afterward. He took the olive leaf extract for 2 months at a dose of 4 capsules a day, and now, and the picture's taken August 20th, 98. He's now dropped to a maintenance dose of 2 capsules a day. Could you shut that light, please? Thank you. We have here psoriasis on the back of the right hand of an 18-year-old woman who had recently been struck by the condition. Pictures taken July 3rd, 98. Afterward, the same hand within 5 weeks of treatment is shown August 5th, 1998. Here we have the before picture of psoriasis on the lower back of a 48-year-old man who has had the condition for 18 years. Picture taken April 10th, 1998. Take a look at that. Here's the same man who took only 4 capsules a day of East Park olive leaf extract for 2 months, and then he dropped to 2 capsules a day for 1 month. Here we see him July the 10th, 1998. Here is the chest of a young man with psoriasis, 20 years old he is. He had the problem for 6 months. Picture taken June 9th, 98. 1 month later, the same man, after taking olive leaf extract at a dose of 4 capsules a day, and this is the result. So now I'm through with my slides, and I'm open to questions. You must have a lot of them, and I'm very pleased to respond to them. Yes, ma'am, what's the first question? No, that is definitely an appropriate question. It does not interfere with friendly bacteria in the gut. In my book, you'll read that tests have been performed in that friendly bacteria were planted in order to make yogurt, and the olive leaf extract was instituted into the yogurt process. The friendly bacteria still made delicious yogurt. Next question. Yes. Yes, if they get their fungus infection again. The question was, will people have a relapse of their psoriasis if they stop taking olive leaf extract? And as I said, yes, if the fungus attacks again. The fungus may be in their environment. They don't get rid of what's in the environment. But I will tell you, there's no reason to stop olive leaf extract. It's not expensive, and it is a definite maintenance for you against getting any kind of microbial infection. Yes, sir. I don't understand what you're saying. There's no risk. As I said at the very beginning, Upjohn, a pharmaceutical company, investigated this for 3 years, did every kind of test that the FDA requires in order to make it a drug, and found there were no adverse infection, no adverse effects. What about the leaves? I didn't hear him. The answer is yes, you could eat the leaves. They're not delicious. They're bitter. You won't like the taste. So making them part of a salad is not going to be very pleasant. But you can brew it into a tea, and you can make a blended drink. Yes, sir. This is not a nightshade. Well, that's another question other than olive leaf extract. That's a question about arthritis, right, or psoriasis. Well, perhaps so, but I'm not responding to nightshade and whether you should eat it or not for psoriasis. I know you're not supposed to eat it for arthritis. Yes, ma'am. You are killing the virus. It's a viricide, and it's a fungicide, and a bactericide, and a protozoazide, and a parasiticide. You can kill the virus. Yes, ma'am, that's what I'm saying. I'm making a direct statement to that effect, and I so prove it in my book, Olive Leaf Extract. I suggest you read it. Get it from the Cancer Control Society. Give me another minute. Another question, please.
4 minutes.
I don't hear you, ma'am. What'd you say? Yes. I don't know. But it does that by using a variety of synergistic agents that are combined in the dextro-turning light isomer of olive leaf extract. I don't know how it works, but it does work. Read my book, and you'll see some case histories in there from physicians who have used it in treatment. Okay. It also makes HIV positive blood HIV negative. How do you like that for a statement? And that's proven in Chapter 8 of my book, and I'm not making the statement. It comes from an AIDS support organization called Keep Hope Alive. Thank you very much, ladies and gentlemen.